The Holyoke Soldiers Home Coalition, comprised of veterans, their families, and local advocates, wants change at the facility. And last week, Governor Charlie Baker outlined several changes he said will improve oversight and operations at the home, where at least 76 veterans died of COVID-19. But the coalition members say Baker's missing something. He has yet to ask them for their thoughts on that change. I spoke with coalition members Cheryl Turgeon, whose father is a resident, and Blais and Laurie Beaudette, whose fathers died of COVID-19. I asked Beaudette why that outreach is important.
Well, we strongly feel that the family members and veteran groups should have a voice in these proposals, the reforms.
And as the governor has outlined several changes in the past week or so. And so do you feel like you just there hasn't been any attempt to get your perspective?
That's how we feel, yes.
So Cheryl Blais, as I understand it, among the things that the family members are calling for is for a renovation and expansion at the Soldiers Home. And as you know, the Chelsea Soldiers Home is getting a sizable renovation. What did you think when you learned that information, that Chelsea was getting what the families here are asking for?
I was very upset. I felt that this has been something that's been in the making for 7 years, and it seems like we're just totally ignored.
And the governor has come out and said that $2 million will be put toward the Holyoke Soldiers Home for both beefing up safety and for infection control measures. Cheryl Turgeon, what do you think about that piece of money being put toward those elements?
I think it's about time that the 70-year-old wallpaper and the decades-old wooden wardrobes that harbor bacteria need to be replaced sooner rather than later, and should have been replaced by now.
And Cheryl, as I understand it, Turgeon, your father has been tested for COVID-19 and tested negative, but you said he still has had those symptoms. He was moved out of the Soldiers Home.
Yes.
And recently, or at some point, was moved back into that facility. How's he doing now?
He's a shell of a man that he was. The regression is obvious. He hasn't walked since the day they took him to the hospital. He has had several ups and downs, all trying to fight back. I'm hopeful he can get back to baseline, but it's going to take a lot to get him there. And it's unfortunate that in his last days here that he's been as sick as he has been.
Is it clear to you who's in charge at the home right now? As we know, Bennett Walsh, the former superintendent, has been fired. Val Liptek, who was brought in on an interim basis, I believe her timing has been cut back, or she's doing part at the Soldiers Home and part of her hours at her previous job. Do you know who's in charge right now?
I actually, just before this meeting, got an email from the Soldiers Home that is indicating that Pat Dill will be the nursing executive in charge for right now, and Val is doing a town hall immediately after this meeting to talk to some of the families. But when I call and ask for some questions and I call the command center, it does take a little bit of coordination still to figure out, is it the interim superintendent? Is it the guard? It's taking some coordination to get some answers still.
For you, Laurie, your father passed away from COVID-19. He was a resident at the Soldiers Home. And I can imagine that it's been an incredibly gut-wrenching and difficult time for you and Cheryl Blais as well, other family members. Why advocate? Why still be involved? You could say, you know what, I'm walking away. I'm done with this.
Carrie, it would be a lot easier to just walk away, but I really strongly feel that I need to advocate for a new home and renovations, because a lot of my dad had a lot of friends there, and he would be appalled at the conditions. And the Mark Perlstein's report that came out, my dad would just be appalled that his friends have to live through this. And I just don't want to see this tragedy, this type of tragedy, ever happen to another family again. It's just horrific. It's like nothing you can even imagine.
Cheryl Blais, how about for you? Same thing. Your father passed away. He was a Soldiers Home resident, contracted COVID-19. Why continue to stay involved and be an advocate for some changes there at the home?
We need funding now, And I saw, you know, how old this facility is, and until we get the money to rebuild this facility, there will be no more changes. And this will happen all over again. And we can't have that happen to our vets. And I am on a mission, as well as Laurie and Cheryl, to make this a better home and give this home what our vets deserve to have. And we're not backing down.
Cheryl Turgeon, how about for you? Your dad is in the facility. Are you concerned that not enough has changed? Are you worried that he or others might get sick?
I am worried, especially if we get a second wave. I'm worried that as health proxies, they would not let us in the facility. They would not let us see them. My father had pressure ulcers develop over several weeks that never should have happened. I wasn't allowed to see the pictures until a month later at a doctor's office, where I was frankly shocked at how bad that they really were. So I think that the Soldiers Home and the governor, all the way to Secretary of State Sutters, needs to know that this is not a binary decision, a yes or a no. Health proxies, along with the medical team, know their veterans best and when they need care and what they need. And that needs to change, and it needs to change soon.
One of the changes that the governor made after former Superintendent Walsh was placed on administrative leave was they set up a hotline. They said communication would improve that way. But Laurie, Cheryl, from what I'm hearing from you, it doesn't seem like communication has improved. Do you feel like it has?
It has in some ways, as long as you're still advocating. Just last week, I asked for a care team meeting to see if we're all on the same page and everything's being taken care of for my dad. And, it was kind of met with a little bit of, well, I'm not so sure. And I'm like, well, no, we need to do this every 90 days as required. And it was set up, and I appreciate that. It was a great meeting. Some things came to light to making sure we're on the same page. But again, as healthcare proxies, we need access to our loved ones, and we need to advocate for them. And if we're not doing that, I worry about what could happen, as this is 2020, and 97 of them are dead.
I've heard several family members in talking about this experience talk about justice and the need for justice, the desire for justice for the people who have passed away, but also the people who still live there, these veterans who've cared for this country in a very important way. Laurie, for you, 4 people so far have either been fired or resigned, whether it's Mr. Walsh or the director of the home medical director, David Clinton. Does that seem like justice for you?
It's not quite enough justice for me. I mean, that's a step in the right direction. But honestly, the greatest justice for me would be a new facility, because it would be a memorial to my father and all the other veterans that have suffered and died. Even Cheryl's dad, he suffered, that's that's justice.
Yeah, and your dad had been in the facility since 2003, is that right? So you've seen a lot of people come and go, and a lot of care there at that facility.
I have, and unfortunately, it was a wonderful facility until 2015. In June of 2015, approximately 46 employees were allowed to take early retirement all at once. Most of those positions were not filled. And immediately I saw the impact on care and morale at the Soldiers Home. And it was awful, because the majority of the employees were extremely happy prior to, this mass exodus of employees. And now they were being demanded to work double shifts and denied time off. And you can't blame them for being upset in working in that kind of environment. And then once it just became a very toxic working environment. They were very unhappy, and their attitudes were running off on the patients. My dad picked up on it constantly, and it really bothered him.
Cheryl Blais, I'll direct the same question to you that I did to Laurie. What does justice look like for you in this circumstance?
I would like to see more of our major veterans groups in Massachusetts to be able to get involved in being part of the board of trustees and to advocate for our veterans so that we can make it a better place. And justice, building a new home, like Laurie said, we need a new facility. We can't go on with the way that it is right now. It's got to change. And that would be justice.
And finally, Cheryl Turgeon, I'll let you respond to that as well.
Unanimous. It's unanimous. We need a new home for the veterans, so that they're taken care of. I loved the idea of having a daycare facility for some of them, within the realm of that. My dad actually went to the Jewish Community Center for about 2 years. It's VA sponsored prior to going to the Soldiers Home. So I know that that's important too, that maybe somebody doesn't need a long-term care facility right away, but they need a check-in place. And I think that's important to add.